I'm pleased to be joined today on Health Beat by Dr. Alex Laudenklos, an obstetrician and gynecologist with Faith Regional Physician Services, OBGYN in Norfolk. And today we're discussing incontinence. So, Dr. Laudenklos, talk a little bit about what can lead to incontinence in females and some options that are available today to help with incontinence.
Okay. Well, thanks, Rob. Incontinence is sort of a multifaceted issue. There are a lot of things that lead to incontinence, whether it's laxity of the pelvic floor or the top of the vagina, the weakness of the bladder muscle wall. Diabetes, for example, can contribute to incontinence as a way that the nerve endings get damaged so that the muscles can't actually contract within the bladder as well. Some of the bladders may actually become smaller in size so that they can't hold as much fluids. So that people feel like they're just going to the bathroom all the time. And there's also within the urethra, there's a muscle lining that also can have some inherent lax in its ability to constrict and keep people from leaking. So it's really, there's a lot of different things that go into incontinence, and there's a lot of different kinds of incontinence. So really, we start with an exam, and we start with asking the patient about their incontinence, how much they're leaking, when they're leaking, those sorts of things, how much they're able to use the restroom, how often they're using the restroom, when they're using the restroom. Those sorts of questions really give us a sort of insight into the type of incontinence they have. And then the exam portion is probably the last part of our clinic visit, and it really sort of helps delineate out to how much post-void residual or how much urine is retained after a person uses the restroom, how much urine they're able to hold within their bladder to a capacity, and then whether or not they leak when they cough, sneeze, or bear down.
So what are some of the treatment options that are available?
So the treatment options available can range from medications to physical therapy and then surgical.
I see. Well, thanks for sharing that with our viewers. We appreciate it. To learn more about clinic locations, specialties, and providers, visit frpsclinics.org.